morning, ladies and gentlemen. We come to you today with our 19th video. We're starting our 10th week of presenting these informative sessions to you, and as always, hope that they are informative for you and that you have some takeaway from what we bring to you today. And I think that every one of them is very important, not from what I say, but from what these people back here that are living and working in this every day as they deal with this virus and working with business, working with families, those that have questions and concerns about where all this is leading to. So thank you, and I hope that you had some time to relax and to reflect over this Memorial Day weekend. We started our first video back on March the 24th, so we're in 3 months, and if we continue this next week into June, we will have brought these to you for parts of 4 months as we make these presentations. So, and on Memorial Day weekend, we went through the Easter holiday and now Memorial Day, and as I said, I hope that you had some time to relax and reflect. Memorial Day should be a day that in some way is with us every day, as we sometimes take for granted the things that we have, the freedoms that we have as a country, and never forget those who made that possible. And not just for us, but for free people all over the world, that they fought to secure their freedoms as well, and to prevent the spread of communism around the world. So we give thanks to those families that lost loved ones, and they're adults today who grew up without a father, without a parent in the home, because they gave their life on the field of battle somewhere, and we especially remember them at this time. So thank you for that. I do want to mention, as we get started, the census for Randolph County. And again, I might have mentioned it the other day, but just remember that if you have your forms, get those filled out. They have a lot to do with how funds are distributed and how our congressional numbers could be affected. We might pick up an additional congressional seat. So we do continue to encourage you for that. This morning, we have 613 cases. Last Thursday, when we came to you, we had 502. So from that time till this morning, we've grown by 111 cases. What I want to say to you this morning is those are not just cases. Everybody looks at these like they're numbers, and everybody puts their own spin on those numbers, and it means this or it means that, and they're trying to determine correlations between those numbers. But every one of those is a human being. All those that have died, our deaths, we have one since we got here this morning. So we're up to 11 now in Randolph County. So that's 4 more than we had Friday morning, so Thursday morning. So it continues to grow, but each one of them is an individual, a human being that's been affected directly by the coronavirus, and their families. Each one had a spouse, had a child, a grandchild, family members and friends that loved and cared for them. And we just want to remember that those are real people. They're not just numbers that people can look to and try to put mathematical statistics to it, but that these are affected lives every day. And when we look at the expanded effect, then we realize the full impact of the coronavirus on the citizens of our county, our state, and across the nation. So as these things continue, just keep that in mind as we go forward, and have concern and prayers for those families that are affected by the virus. I think that is essential to us as survivors, as those who deal with it and have been able to avoid it. So please keep that in mind. As I've been doing, I do want to have a little spiritual comment, some scripture for you this morning. I was reading through my Bible over the weekend, and I had 2 or 3 different passages of scripture, but sort of along the lines of how we're dealing with the coronavirus and its effects on lives. There's one just a couple verses, 2 or 3 verses that I just couldn't seem to get away from, and so I want to share that with you this morning. And you remember the time when the lawyer came to Christ and he asked him, what is the greatest commandment in the law? And Christ said to him, and this is in Matthew the 26th chapter, and starting with the 36th verse, "Thou shalt love the Lord thy God with all thy heart, with all thy soul, and with all thy mind. This is the first and the great commandment. And the second is like it. Thou shalt love thy neighbor as thyself. On these 2 commandments have all the law and the prophets." These are the 2 most important commandments, that we love the Lord with all of our heart, our soul, and our mind, and that we love our neighbor as ourselves. Now when you think about that, to love the neighbor as you love yourself, that's pretty deep. And we should be mindful of that. It brings up the other occasion when someone said, "Christ, who is my neighbor?" And he told the story of the Good Samaritan and how the priest and the Levite passed the one who had been taken by the thieves, who had been robbed and beaten, and took him and cared for him and dressed his wounds and took him to get medical attention. The Samaritan, who was the enemy of the Jew, if you remember. So who is our neighbor? Our neighbors are all these folks that are dealing with the coronavirus in their life, who struggle, who have the fear. What if it happens in my family? What will I do? And just keep that in mind as we think about who we really care for. And I know that we love our immediate families, and I have family myself, and of course grandchildren, all that. But who is our neighbor? It's those that have needs today. So in whatever way that we can, directly or indirectly, let's remember those that deal with the coronavirus every day in their life. And we still have a ways to go in dealing with this. Our county is a good example of that. And we've begun to open things up. I think I've mentioned before, I work for a funeral home. I worked a funeral week before last for a family whose husband and father passed away in a nursing home. He did not have the coronavirus. But being in a nursing home, his family was not able to have direct contact with him. And in the funeral home, rather than the flowers that we typically see around the casket and within the viewing room, the family had brought in these signs, graphs that they had done while their father and husband was confined in the nursing home. And each day they would go to that funeral home and they would write a message on one of those cardboard pieces and hold it up at the window so that their loved one could read it and know that they were thinking about him. And around that room in the funeral home that day were multiple copies of the messages that they had brought to their loved one while he was confined in that nursing home. So that's part of the issue too. Even though someone might not have the virus, their family's still not able to have contact with them because of the requirements of protection and safety. So keep all these things in mind, and I hope that you enjoy your week. Have a good week. Looks like we're going to have another rainy week, but come July and August, we'll be happy we had the rain. So thank you today, and God bless you, the citizens of Randolph County. Thank you.
Good morning. Susan Hayes, Randolph County Public Health. Today's case count at 9 a.m. is 613. Sadly, we had 4 deaths over the weekend. That brings our total death count to 12. Recently, we've been hearing a repeating theme when we talk to people who test positive for COVID-19. Oftentimes, they will tell us that they continue to go to work. When we ask why, what we're told is, well, I really didn't feel that bad, or I didn't have a fever, or I was a little dizzy, but that was it, or I had a scratchy throat, or I just thought it was a sinus infection. This morning, I wanted to remind you about what the symptoms for COVID-19 are. People with COVID-19 will have a wide range of reported symptoms. Sometimes they're extremely mild, sometimes they're very severe. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may often feel one or none of the following symptoms: fever or chills, cough, shortness of breath, fatigue, muscle or body aches, headache, loss of taste or smell. We've had many who that has been the only symptom they've had. Sore throat or just a scratchy throat, enough that you think, it's just allergies. Congestion, runny nose, nausea or vomiting, diarrhea. In some of the cases we've seen, we've had complaints of, my stomach didn't feel good. These are important issues to notice. If you feel any of those symptoms and you think there's a possibility that you could have been around someone who was positive for COVID-19, it's extremely important that you do not go to work. The North Carolina Department of Health and Human Services recently expanded who should be tested for COVID-19. The guidance recommends testing anyone with symptoms suggestive of COVID-19. And any close contacts, so if you've had a close contact that was positive for coronavirus, you have to or should get tested regardless of your symptoms. Even if you don't have symptoms and you've been a close contact, you should call your physician. Doctors should ensure that anyone at higher risk for exposure or higher risk for severe illness should be tested as well. This would include people who live in or have regular contact in high-risk settings, like long-term care facilities, homeless shelters, correctional facilities, or a detention center like the jail, or migrant farm worker camps. People who are at high risk for severe illness, those that are over age 65, or anyone of any age with underlying conditions. People who have come in contact with those that could have coronavirus. Healthcare workers or first responders. And frontline and essential workers in settings where social distancing is often difficult, like the person that works at the grocery store or in the child care center or the gas station attendant. These are all people that should be tested for coronavirus. So if any of these fit you, please consider calling your doctor and ask about being tested. The urgent cares in our county are also available to do testing. If you test positive for coronavirus, it is absolutely crucial that you isolate at home. Please remember, if you have questions of any kind, any concerns about how you're feeling, about symptoms, about whether or not you should be tested or where to get tested, anything related to COVID-19, please call our hotline at 336-318-6227. Thank you.
Information in a time of crisis can be a citizen's most valuable resource, and we thank you, Commissioner Darrell Fry and Public Health Director Susan Hayes, for your comments and your updates on the coronavirus and its impact on our community. This is Randolph County's 19th video that has been designed to provide you with up-to-date information and insights, not only on the status of the coronavirus pandemic, but also how the departments and agencies of Randolph County government provide the services you require during these challenging times. To date, in addition to regular updates from Commissioner Fry and Public Health Director Susan Hayes and the County Manager, we have spotlighted the following Randolph County departments, agencies, and organizations: our Sheriff's Office, Emergency Services, Public Schools, Public Health Representatives, register of deeds, social services, risk management, animal services, economic development, our veteran service offices, cooperative extension service, county inspections, our senior adult association, and our county wellness administrator, who maintains coordination with our business and our industry and our local governments. Over 21,000 people have viewed our videos, and we thank you for that. And today, our next update will be presented by Kendall Phillips, who is a health educator with the Randolph County Department of Public Health. As county manager, I am so proud of all our county staff that are meeting the challenges of this pandemic. However, the expanding roles and necessity of health educators continues to grow and evolve as we adapt to these new challenges brought about by the pandemic. Health educators teach people about behaviors that promote wellness. They develop and promote strategies to improve the health of our citizens and our communities. They are a vital link between the county government, our community, and our many healthcare professionals. At no time in our history has the role of health educators been more critical for our citizens than this time of global coronavirus pandemic. Kendall's going to update you now on the expanding roles of our health educators and how they are a critical link in our community and the public's health.
Hello, I'm Kendall Phillips, one of the health educators here with Randolph County Public Health. I'm here today to talk to you about ways to keep yourself and others safe and healthy as we move into Phase 2 of North Carolina's reopening plan. Phase 2 just means that we currently have access to healthcare and hospitals in case you get sick. It does not mean that there is less risk out there of a person getting sick. I want to draw your attention to this map of North Carolina. This is showing the rate of infection per capita. So the darker the shade of orange, the more infection there is in that county. As you'll see, Randolph County is not the darkest shade, but we are the second darkest shade because we are currently 14th out of 100 counties in North Carolina for rate of infection. Now more than ever, it is really important for all of us in Randolph County to practice our 3 W's, which means wear a cloth face covering, wait 6 feet from others, and wash our hands. Today I'm going to demonstrate all 3 of these 3 W's so that way we all know how to take good care of ourselves and others while we are out in the community. The first is wear a cloth face covering. Let's start with wearing a cloth face covering. Wearing a cloth face covering is going to help keep your respiratory droplets into yourself so that way they don't land on others whenever you speak, if you cough, or if you sneeze. It essentially protects other people from you in case you are infected and may or may not know it. Whenever we put on our cloth face covering, we want to make sure that we wash or sanitize our hands before and after we put it on. So let's pretend that I'm out running errands, I'm about to go inside of a bank, so I don't have access to washing my hands. So what I'm going to do is use my hand sanitizer. I'm going to rub it in completely until it fully evaporates. It's important not to just let it linger on your hands wet and just kind of shake them out. You want to really rub it in all over your hands. Get between your fingers, on the backs and sides of your hand. Now we're going to use our face covering. We're going to handle it by the ear straps. If yours has ties, then hold it by the ties. We're going to open it, put it around our face and around our ears. We want to make sure that it fits snug to our face, is over our nose, and above or below our chin. So that way it's completely covering all of our face. Now, whenever we're out in public, we want to make sure that we're not touching the front of it, we're not pulling it down, because every time you touch it, you're now exposing your hands to other germs, and then you could also be touching more germs to your face. Whenever it's time to remove it, again, we're using the ear loops or the ties. We're going to slowly and safely remove it, and then we're going to drop it in our laundry basket so that way we can just wash it and reuse it for later. And then we're going to, again, sanitize our hands or wash them if you have access to hand washing at that time. Now let's talk about waiting 6 feet from others. You may have heard the term social distancing by now. What this means is keeping ourselves far enough from other people's respiratory droplets. We know that COVID-19 is spread primarily through close, prolonged contact. The way we define close contact is being 6 feet or less for 10 minutes or more. The longer we're exposed to somebody's respiratory droplets, the higher the risk of being exposed to the virus, which is why that distance is so important. So if you are out at a grocery store, running errands, if you're going to a family cookout this weekend, anytime you're around other people, it is really, really important to stay 6 feet from all of them. Now we're going to go on set and talk about hand washing. Hand washing is one of the best tools we have to protect ourselves and others. Hand washing works well for 2 reasons. First of all, the virus has a lipid envelope around it, which is just a layer of fat. Soap actually breaks down that lipid envelope and that layer of fat, and it destroys the virus so that way it cannot infect you anymore. The virus also likes to cling to the oils on our hands. So whenever we are going about our day and we're touching all these surfaces, we're touching our mouths, we're touching other people, the virus is clinging to the oils of our hands. Whenever we wash our hands for 20 seconds with soap and water, we break down that oil and we remove all of the germs from our hands. So I'm going to show you how to wash our hands properly. We're going to start by turning our water on. It doesn't matter if the water is hot or cold because it's the soap that's doing all the work. We're going to put soap on our hands and we're going to scrub, again for at least 20 seconds. We want to make sure that we get in between our fingers, we get the sides of our hands, and that we rub all over the rest of our hands. We want to get our wrists as well. If you're wearing any jewelry like me, make sure you get underneath your jewelry. And the most important part that we sometimes forget about is getting underneath our nails. You'll take your hands and you will scratch your palms in small circles, and that's going to disrupt all those germs hiding out underneath your nails. Whenever I'm teaching children in school, I like to call these my bear claws. That usually kind of gets them into it. So again, we're going to go all around and just hit all of our spots one last time, getting our thumbs. And then we're going to rinse. We're going to make sure that we're using that friction and that we're rinsing all over. Next, we're going to use a dry, clean paper towel. We're going to dry our hands. And then we're going to use that paper towel to turn the water off so that way we don't reinfect ourselves with whatever was just on our hands when we turn the water on. Then we throw it away and now we have nice clean hands. I get a lot of questions about wearing gloves. Hand washing is still going to be more effective than wearing gloves because it's going to remove everything that we just washed off of our hands. But if you feel more comfortable wearing gloves, it's important you do it the right way. So before you put on gloves, you want to wash your hands like I just did. And then we want to make sure that we are not cross-contaminating. And what that means is everything you touch while you're in the grocery store, while you're out and about doing your errands, is now on your gloves. So if you don't take your gloves off the right way, then you could have all those germs that are on top of your gloves now on your hands, and then you're going to need to wash your hands after. So if you have your gloves on and it's time to take them off, what you want to do is pinch right here and roll off so that way your hands never touch the infected part of the glove. Then you want to take a finger, wedge it underneath, and roll out. And then you want to throw them away, not in the parking lot of a grocery store, not just anywhere that feels convenient for you, and then you want to wash your hands again. So remember our 3 W's: wear a cloth face covering, wait 6 feet, and wash your hands. Wash your hands, wash your hands. These are 3 things that we can all do to keep ourselves and others safe and healthy. It is up to all of us to work together to protect the public's health.